Hi, Dr. Lewis, Cady here at Cady Wellness Institute with an exciting update about some things that we've got here. You'll see this machine on my left, and I can now tell you about it. In the past, I had signed a non-disclosure agreement about some research I was doing with the company BTL that developed this device. Here's the point. This is a TMS machine for the 21st century. It's got what amounts to a Star Trek transporter type control system for what exactly one is going to be doing for the brain. But this is basically pulses in the so-called dorsolateral prefrontal cortex of the brain. Now, what does this mean? This area of the brain is the CEO of the brain. It controls what you're paying attention to. It determines your emotional regulation to an extent. It also determines your Archie Bunker function. For those of you that are old enough to remember All in the Family, you'll remember Archie Bunker was famous for saying, stifle yourself. Well, in terms of food cravings and impulse control, this is the stifle yourself area of the brain. And it's pretty important. Now, in the past, in this very room where I'm standing, I had an older TMS device, which we still got. It's gathering cobwebs, but I'll show it to you. It was called the NeuroStar TMS device. It was a chair, and you sat in it, and there was a very precise process of finding the exact spot in the brain to zap. This one is much more user-friendly, and it's more patient-friendly. So it's faster to set up, and it is virtually painless. I've never had a patient tell me that this is a painful treatment. The NeuroStar was like an ice pick going into your head. This one, people are lying on the table here and saying, can I go to sleep? This is a remarkable device, and there are some no's about this device. There are no drugs for the treatment of depression or food cravings. There's no downtime. There's no dependency, and there's no withdrawal. This isn't one of those things that you have your treatment and then you have a withdrawal from it. You have the treatment, you drive yourself back home, you may sleep better that night, but that's about it. And in my experience, since I have had this first for experimental study, and then I've been kind of freelancing with it with my patients, I have found that 2 treatments on this machine have, in 2 separate cases, blasted a patient right out of their depressive state. That's unheard of. So without going into the details, I will tell you this is far more powerful than the machine that I had, and simultaneously it's much more comfortable, and it is much more effective. So it is FDA approved for the treatment of depression with a specific protocol. We are also experimenting with more efficient ways to use this machine here at CWI for depression. So if you're on a medication and it hasn't worked, or if you have not been on a medication and you're just freaked out about the possibility of being on a medication because you don't want dependency, you don't want withdrawal when you stop it, etc., then you should talk to us. This is the Exomind from BTL, and it is remarkable technology. Come see us.